Hello, ladies and gentlemen. Welcome to Health, Hygiene and Wellness. My name is Barasa Saenyi Nicholas. This is Imani Television, the #1 TV station that builds your faith in Jesus Christ. In our show today, I have Dr. Silas. As you know, the last year he's been here expounding more issues about our health, and we've learned a lot. And we expect that this year as well, if God grants him blessings, we will learn much from him in due time. But today we are going to begin with a heart attack as well as stroke. We will define it, we will talk about it, know the causes, the prevention, as well as drug administration for the healthcare workers as him. So karibu sana daktari.
Thank you so much.
Yeah. How is your year? Happy New Year.
Happy New Year too. It feels good to be in 2024. We thank God.
Yes.
Yeah.
Now, let's just narrow down to heart attack and stroke.
Yes.
How can we define these diseases?
Heart attack per se or stroke, we classify them under cardiovascular diseases.
Yes.
And basically, when we talk of cardiovascular diseases, if we roll back to our biology in high school, we are looking at the heart and the blood vessels. So the way God created our body, the heart's work is to pump blood through the blood vessels, and, so that it can supply nutrients, oxygen,
Yes.
and provide, and even some other, even the blood itself, it has the other components that are very important in our body. So the function of the heart actually, as people age, sometimes it deteriorates and they might develop some diseases. And the eventualities of these diseases can result in what we call a cardiovascular accident. So these cardiovascular accidents, as we call them, they are actually accidents. And these accidents, a good example is what you have just mentioned. The heart attacks and strokes, they are actually cardiovascular accidents. What do we mean by accidents? It means that you didn't expect it to happen, but it happened, because it happens in a glimpse of an eye, and actually you just realize that you have the problem, and a few minutes ago you are okay.
Yes.
So we call them accidents because there is something, like, for example, if it's a stroke, there is a clot that just comes from nowhere and moves and blocks some artery in the brain, then you develop a stroke. If it's a heart attack, there is a clot that just forms from nowhere and actually comes and blocks an artery in your heart, and you develop a heart attack. So we call them cardiovascular accidents because they actually, you didn't expect them.
Yes.
That's why people die of sudden death. They don't know, they cannot predict them, they are hard to predict. So they are like accidents, just like an accident on the road. It's not easy for you to predict. So again, in our body, there might be that accident whereby blood is flowing very well from the heart to the arteries. But all of a sudden, something happens that this blood is no longer flowing to a specific organ, which is the heart or the brain, and somebody develops this stroke, or they develop this heart
attack.
Yeah.
Are there any predisposing factors for these accidents?
Yeah, they are common. Actually, you cannot just develop an accident today.
Yes.
Just like on the road, you cannot just wake up and have an accident. There must be something. Maybe the road is bad, or maybe your car is not in good condition, is not roadworthy. Maybe the traffic is too much. The other users of the road are not good. So even in our body, the journey of the blood from the heart to the specific artery,
Yes,
and coming back.
Now, Daktari, are there any predisposing factors for these accidents that happen?
Just like on the road,
Yes.
there is no way this accident will just come. There is always some predisposing factor. Maybe the car is not roadworthy.
Yes.
The other users of the road are not friendly to you, or maybe the road is not good, it's bumpy, the traffic is too much. So there are other factors that predispose. If you see a person coming to the hospital with a stroke or a heart attack,
Yes.
there is always a risk factor.
As you said, Daktari, the predisposing factors are just like any other accident.
Yeah, the predisposing factors to stroke are just like any other accident on the road. And actually, there is always a predisposing factor to this. You can't just wake up today and have a stroke. There is always something that is happening in the body. Like on the road, the cars might be not roadworthy, the road is bad, there is much traffic.
Yes.
So also in the body, there is always something that is happening. For example, you might wake up today and find that you have a headache. Then you decide to say, let me just take some painkillers. The headache goes off. That is a sign that you might be having a stroke.
Yes.
And you might have a stroke in a few days to come. And I'm not saying that all headaches will lead you to stroke, but just be cautious. Go to hospital. You know, people have the habit of buying medications from the counter and just counteracting the pain that they have. But it is not good. It's good for you to go to a doctor. We can always pick even a high blood pressure that might be leading to your headache and later on even cause a stroke. And by the way, anytime you have a high blood pressure that is causing a headache, it's a high risk, it's even a danger sign for stroke. If you have a blood pressure that is silent, well and good, but it's not even good enough to get you a stroke. But if you have a high blood pressure and there is already a headache, could be a risk for stroke. The same, if you have high blood pressure and there is chest pain, it's a risk for a cardiac arrest.
Yes.
So you need to be more suspicious. Anytime you have a chest pain, you are taking amoxil, it is not going off. Some people usually call that chest pain pneumonia. And you know, when they come to the hospital, we check for pneumonia, it's not there. It is not pneumonia, it is chest pain. And it has some other cause, not necessarily pneumonia. So if your doctor tells you this is not pneumonia, agree with the doctor. If your blood pressure is high, likely it is the blood pressure that is causing the chest pain.
Yes.
So in short, the predisposing factor to stroke and
Heart attack.
Yes, are simple. There is blood pressure, there is high blood pressure, there is diabetes. Those are the leading causes of stroke. Then we also have obesity. Obesity is a cause for stroke. And there are many people who usually confuse stroke, heart attacks, and stress. They are not stress. You know, if somebody has a stress, not necessarily will they get a heart attack or a stroke. People usually say they got a stroke because they were stressed up. Maybe
because of pressure or something.
No. What happens, your body did have blood pressure. There is what we call a metabolic syndrome, where there is a lot of cholesterol in your body, there is a blood pressure, there is diabetes. So when you get that stress, it just triggers. Not that it's the stress that caused the stroke. But when somebody comes to the hospital with a stroke, the relatives are there saying, they're even killing someone at home, saying you are the one who has caused our mother to have this stroke. No, that person is just triggered. But this, your mother had risk factors for stroke, and which we are saying it is high blood pressure, it is diabetes, it is obesity, lack of exercise. There are people who work in big towns, urban centers like Nairobi, where they sit for long hours. The MPs, members of parliament, these people, the CEOs, they stay for long in long meetings. And, you know, just by sitting for long, it's a risk for stroke. It's a risk for a heart attack. You hear that somebody was in an office today. When they went home, they went to the bathroom, they bathed, then they fell in the bathroom, then they actually got a stroke or a heart attack. Why? Because they were sitting for long. After sitting for long, in maybe for more than 6 hours without standing, the blood can clot, or maybe the body can, even your blood pressure might increase over time, then you get a stroke. Apart from that, there are other diseases like HIV, sickle cell, there are diseases like cancer that can lead to people having stroke. There are even these people who use steroids. There is this drug called prednisolone. There is this drug called diclofenac. People usually buy it over the counter. If you continue using such drugs, they can lead to what we call even hemorrhagic stroke. There are two types of stroke. There is a stroke that comes because of a clot. There is a stroke that comes because your blood arteries rupture. When they rupture, they usually cause bleeding in the brain, and this causes stroke. So there are those causes, and you just have to be keen, see your doctor, consult with them before you buy any medication over the counter, and this can prevent the stroke. Lastly, on the risk factors is smoking
Yes.
and alcohol use and nyama choma. People who love nyama choma, you are at risk of stroke, because nyama choma actually puffs a lot of fat in your arteries. So when this fat accumulates in your arteries, over time, they might dislodge from the walls of the arteries and form what we call an emboli. So this emboli is actually a clot that will block the small arteries, even in your kidneys, in your eyes, in your brain, in your heart, and cause a stroke. So if you love nyama choma, it's good that you eat it, but not regularly. Maybe once a month or maybe once a year, if it's possible.
For your health.
Yeah, for your health. So alcohol is another cause. All types of alcohol. You know, people usually say that beer is good than spirits, or maybe changa is good than what. But all types of alcohol will give you a risk. So
Yes.
as long as it is alcohol,
Yes.
it is a risk. Smoking, even one stick of cigarette will give you a risk for a stroke.
Wow.
So you just have to stop it.
Those are the predisposing factors as well as the causes for heart attack and stroke.
The causes for heart attack and stroke, actually, there is actually what I've said, over time, as you are accumulating this cholesterol in your arteries,
Yes.
the arteries might be weak. So if they are weak because of high blood pressure, let me use an example of high blood pressure.
Yes.
You have had high blood pressure, the doctor diagnosed you, let's say in 2020. You took your medications, your blood pressure was 200 over 100 at that time. Then you took your medication, your blood pressure came back to 130 over 80. So when you went back to the doctor told you that your blood pressure is normal and you don't need, you need to continue with the medications. You went to another doctor, the patients are sometimes very funny. They go to another doctor, they tell them, check if my blood pressure is okay or not okay. Not the primary doctor who saw them. So this doctor checks the blood pressure and they tell them, your blood pressure is normal. Do I need medications? Then this doctor tells you no. You are not telling them the story of how you had a blood pressure of 200 over 100
At one time.
At
Yes.
one time.
Yes.
So you decide to stop your medications. Or maybe you switch to alternative methods, like you go to herbal, you go to other medicines, alternative medicines. People cheat you that maybe they can work, and yet they are not working. It's the primary drug that the doctor gave you that is working. Then this blood pressure subsides. It continues being normal for 6 months. Then all of a sudden, it just rises without your knowledge, and it makes your arteries to be very weak. So at one point, when there is a trigger, like what I was saying, stress, when the stress comes, it makes your blood pressure to go very high,
Yes.
and it ruptures the arteries. That's how people get heart attacks. That's how people get strokes. Number two, if you are obese or maybe you are overweight.
Overweight, yes.
So if you are overweight, over time there is accumulation of cholesterol in your arteries. And not necessarily those people who are overweight will accumulate arteries. Even slim people, we've seen many cases of a lot of cholesterol in slim people, because they are the ones who are eating a lot of nyama choma. Only that we can
Expecting to be fat.
We can say it in Kiswahili, mwili haijakubali.
Mwili haijakubali.
Yeah, so if your body has not accepted, if
Yes.
I can put it in raw Kiswahili,
Yes.
so kama mwili haijakubali, does not mean that you don't have cholesterol. You still have, people, when you talk of cholesterol, people point at those people who are obese or overweight. No, even the slim guys, they have a lot of cholesterol. So this cholesterol accumulates over time, and actually it dislodges and causes a clot. This clot moves slowly. Maybe it is from the leg. It moves slowly all the way to the heart.
Through the arteries.
Through the arteries.
Yes.
When it goes to the heart, it blocks a small artery. You feel very sharp chest pain, then you fall down, or maybe you lose your consciousness. When you go to the hospital, you already have lost your life because of a heart attack. So those are the causes, specific causes. There is always a trigger, then over time, there is a cause, and actually a person develops the stroke or a heart attack. Yeah.
Daktari, are these cardiovascular diseases
Yes.
genetic to some families, or it's just not genetic at all?
Yeah, they can be genetic, but strongly they come because of our lifestyle. Especially people who stay for long hours seated, they are at risk of a stroke. So what we advise people who work in offices, maybe shops, and when I talk of offices, does not mean just that person who is working in Nairobi. Even that mama mboga who is sitting on that chair selling vegetables for long, they can get a stroke. They can get a, if they don't stand on that chair and walk. And you know, people are used to getting even lunch from where they are seated. Like if you are in an office, you just call a vendor to bring you lunch where you are seated.
Yes.
If you are a mama mboga, there are people who just pass around and they give you tea, they give you what you want. You know, those things are not good. You need to stop, break for an hour from your workplace. Go out, walk, have lunch, stretch, take some little water, then come back. Because if you continue sitting for that long, you will get some problems. Then also, if people, maybe if people get some other risk factors, like for example, they are not doing exercise, they get obesity, they are not working on their weight.
Yes.
It is another great risk for the cardiovascular accidents. So the cardiovascular diseases, and actually another very simple thing, you have blood pressure, you have not controlled it, you have not accepted. There are people who say this blood pressure just came because of stress. And now that I'm out of that marriage, I can't take medications again because I feel if
okay
I'm
now.
out of this marriage that was causing stress,
I won't get more pressure.
I won't get more pressure. But it's not the marriage. It is other combined risk factor. Maybe the person who is telling you that has, you'll realize that maybe they are obese and they are blaming the marriage as the stress. Maybe the risk factor there, the great risk factor there is obesity. So work on your weight, your blood pressure will go down and you'll feel okay. So if you have diabetes, if you have hypertension and you are not controlling them, definitely, God forbid, but at one point they might cause a cardiovascular accident. They might cause a stroke, they might cause a heart attack. So you just have to control them.
Daktari, do all strokes lead to death or heart attacks?
Not really, not really. In fact, strokes and heart attacks, if they are realized early, they cannot cause death. So the challenge that we have, for example, for a heart attack is that if somebody gets a heart attack, what determines their survival rates is the center of the heart. You know, the heart looks like a globe.
Yes.
So you are looking at the heart at an angle of 360 degrees. So if that part that is having a clot, or if that part in that artery that is having a clot, we call them the coronary arteries. If that coronary arteries that is having a clot supplies the main part, like on the left side, you know, the engine of the heart is on the left side of the heart. So if it is specifically the left side of the heart, then somebody might lose life. But if you get an ambulance, you know, there is that theory that says if you get a heart attack, you have to reach the hospital within the next 15 minutes, which in Africa, I feel it is quite impossible because hospitals are quite far,
yes.
And the ambulance is out of reach most of the time.
That's
but
true.
If you go to other developed countries, there are ambulances all over the streets. So when somebody gets a heart attack, there's just a number you call, this person is put on the ambulance, and the ambulance is actually a hospital.
Yes.
So Kenya, we are trying also to have ambulances that are hospitals, that can have oxygen, can have cardiothoracic surgeons and other people who are paramedics who are able to start life saving as you head to the hospital.
Yes.
Not just piling you in an ambulance, then they put it on you, or put you on oxygen, and you continue suffering from the heart attack. So the challenge with heart attacks is that you have to reach the hospital very quickly. That's why we say it's better to prevent than to treat a heart attack, because they have to open your heart and correct that.
Yes.
There are other drugs that have been discovered where they can give you and they dissolve that clot. But if it's a ruptured artery, unfortunately, this ruptured artery has to be corrected. And God is also faithful. there are some patients whom God helps. I can say God helps them.
Yes.
Because what happens when they get a heart attack, that artery that has ruptured, there is a new artery that just forms immediately. God just makes the artery to form immediately. We call them anastomosis. And it delivers blood to that area that is not getting blood. So if you happen to be loved by God that happens, you will survive of a heart attack. And it has happened regularly. People don't know. I work in a cardiac clinic, a heart clinic.
Yes.
And when we do, there is a test called ECG and echo. When we look at people's heart, we find that they had a heart attack, they survived, and they never knew it. Why?
Wow.
Because of God. Because there is a healed myocardial infarction. So when you do an ECG, you realize that there are some waves that are showing you that this person had a heart attack sometime back, and they got healed.
Yeah.
Why? Because God, they had a heart attack, the artery ruptured, but God created a new artery that moved against the old artery that had ruptured and supplied blood to the area that was not getting blood. So that happens in some cases, and we've had people who had sharp chest pain, then it went off, maybe they even collapsed, and they just felt okay. Why? The heart attack got healed by itself. So sometimes even strokes, we've had people who have had strokes and they get healed once. Even the mount deviates, there is a weakness of one side. I think we look at that when we look at the signs.
Yes.
And actually they got well. Why? It's because of God. So, but all in all, you don't have to wait for that. Just control your blood pressure, control your blood sugar, and you'll be okay.
So not all strokes or heart attacks lead to death.
Not all, but research says that almost 60% of heart attacks can lead to death, and almost 50%, not 50%, 40%
Yes.
of all strokes can lead to death. So you can look at that number. That means actually 6 out of 10 people that get strokes can actually lose life, or maybe 4 out of the people that get 6 out of 10 of people that get heart attacks can die, and actually maybe we say 4 out of 10 people that get strokes can die. And there is a very bad statistics nowadays. Every hour then we are losing somebody because of, in the world, we are losing someone because of a heart attack or a stroke. And actually, cardiovascular diseases are the leading causes of death in the world. Even in Kenya, they are the leading causes of death. They even subdue the infectious diseases. So people need to take care of cardiovascular diseases. They can cause death.
Daktari, what are the signs and maybe symptoms, if there are any?
The challenge with the heart attacks and strokes, they are very silent. They are very silent. If somebody is going to get a heart attack, you can rarely know that they will get a heart attack. Even doctors, people can come to our clinics, we treat them of hypertension, then they go back home and they lose their lives. We have even had court cases, maybe saying doctors were neglected their patients. At times it is difficult. It is very difficult for you to know that somebody will have a heart attack. So the best way is to prevent. If you have a high blood pressure, control it. Don't stop drugs. Who told you that you should stop drugs in the absence of a doctor? The doctors are the ones who are supposed to tell you to stop your medications. If you have drugs for diabetes, go to a doctor. And don't just go to any other doctor and tell them that, I feel like I don't have diabetes. There's a doctor who started me on drugs. Of course, they'll test you and they'll realize that you have a normal blood sugar. But these diseases, we don't look at the numbers. We look at the disease itself. If your blood pressure is 114 today, it does not mean you don't have hypertension. If you once had hypertension, definitely you will have that. But the signs, the key signs when somebody is going to get a heart attack, I'll try to separate them. There is severe chest pain that actually moves to your jaw here. Or if it is not moving to your jaw, it can move to your left arm, shoulder.
Yes.
Yeah. That is a sign of a heart attack. And sometimes you can have a very excruciating chest pain, one that you have never felt before. That chest pain comes once, sharp, then it subsides. Then another moment you will feel there is another very sharp chest pain that now brings you down. Then you can lose your consciousness, you can collapse, and actually you might even you start having difficulties in breathing. There are other heart attacks that just come, they are very funny. Somebody just starts coughing and it is a sign of a heart attack. There is other people who can start coughing even blood, especially when there is a ruptured artery. We've
Yes.
seen cases where there is people who start coughing blood, they have difficulty in breathing, then they collapse. So that could be a sign of a heart attack. Then there's also loss of balance. Sometimes when you are walking, you lose balance. You can't walk on a straight line. You feel dizzy. You feel a very sharp headache. It could be a sign of a heart attack. So the cold extremities, when your limbs are getting cold, warmth, and you know it happens suddenly.
Yes.
But as I told you, there are some signs that might come early in the course of the day. You might feel like you are losing your breath. Then you continue. You might feel like you are having chest pain. You take painkillers. You take drugs for pneumonia. You feel better. And yet, it's a silent heart attack that is coming. And I want to mention specifically,
Yes.
people who have diabetes, they have silent heart attacks. Why? Because their nerves have failed. So they cannot even feel the pain. They just collapse. So if you have diabetes, don't wait for these signs. You just have to be checking your heart regularly. There is a test called ECG. There are some tests, we call them, they can look at your body and see if you have a risk for a clot. So if you have diabetes, you have to be checking them yearly. And they are not very costly. I think even NHIF covers for them. For a stroke, it is simple. You will realize that when you want to stand up, your one side is weak. For example, the left side, the arm cannot be raised. If you try to raise it, it just comes back down. Then your limb can also not move. Then your mouth deviates. It can deviate to the left side or to the right side. Then your eyes, one eye can stop closing or it can close forever, that it does not open. Then there is drooling of saliva from your mouth. Then you lose your speech. There is weakness of one side completely. Then there might be a sharp headache, but not always there. It's just weakness of one side. There are some types of stroke where somebody just has maybe weakness of one side, but they can walk. But very severe strokes, they paralyze your hand, they paralyze your leg. So that is a sign of a stroke. Yeah.
They go along with the signs of heart attack as well.
For a heart attack, as I've said, it's chest pain, and it's actually severe chest pain that moves to this. So heart attacks and strokes, they are different. You can have both of them, but it has never happened. I've not seen in my practice where somebody is having a stroke and a heart attack. No.
At the same time.
By the time the clot moves to the heart, it cannot reach the brain unless you have multiple clots. Like there are people who are using children who suffer from sickle cell. I've seen such cases where they have multiple clots. There is a clot occluding the brain. There is a clot occluding the heart. So they can have both a stroke and a heart attack. Yeah.
Now, what does someone need to do when a friend or a family member is having a heart attack or a stroke?
Yes, that's a very good question, and I like that I like it that you have asked it.
Yes.
These people will always collapse, and when they collapse, they lose consciousness. We've seen people who like putting things in the mouth, like spoons and what have you. They just want to occlude the tongue so that it cannot block the airway. Don't do that. Then there are people who want to start pouring a lot of water,
yes,
and
water.
other things, putting glucose in the mouth. The reason for that is not well known. Please don't do that. What you need to do, you put the patient in a recovery position. I think those who have gone to first aid classes know that. If you put a patient in a recovery position, raise their head a bit, it improves circulation. Then you can even raise their
The
feet
feet
up
as well, yes.
so that the blood that is down there can come to the vital organs, because in the legs here we don't have any vital organs, but at least from the belt up we have vital organs like the kidneys. So we want the blood that is remaining down there to come back and supply the vital organs, because all you want at that point is to make sure the brain does not fail, the heart does not fail. Once you achieve that, somebody will be okay. But if the brain fails, if the heart fails, does not get enough blood, you lose a life. So strokes, what I know about strokes, it is easier to get recovered from strokes than heart attacks. So we have many people who got strokes and they are okay. After 6 months, after 2 months, after 3 months, they get well. But if you are at home and somebody gets a heart attack, if you can talk to them, you tell them to cough very fast. When somebody coughs, they always force blood into the heart. So you might be lucky enough that what I was telling you, the miracle of God, whereby the heart heals by itself, it can happen. So the blood might be forced into the heart and even be pushed to the area that is not getting blood at that time.
By coughing.
By coughing several times, like 10 times continuously. Then you have to let the person also not stand up. They have to be seated or lying down, probably seated. Because when you are standing, your brain does not get enough blood. So you might even collapse. So what we request people at home, you encourage this person, if you can talk to them and you are seeing that they are getting a heart attack, let them cough. Then for those who have already collapsed, you can do a CPR, whereby you press their chest several times. You just
the lung position.
The lung position, you press the chest severally so that you can increase the circulation of blood to the heart. As you always call the ambulance, or you always call the emergency team. And an ambulance, it's good to have an ambulance. I've always told people, even these police cars, they are not meant to carry criminals only. If you call the police, they can get your patient to the hospital. Very good police officers will do that. If you call a motorbike, there are those village ambulances, we call them a motorbike. At least you push the patient to the nearest hospital quickly so that they can even get oxygen. So let's not despise even the border guys. They can save your life. So the idea of a stroke, the idea of a cardiac arrest is you need to get a patient to the hospital. Then lastly, on that, please, if a patient gets a stroke, never do this. Never give them blood, maybe drugs for hypertension at home. I know, have seen many cases where people get a stroke. Then when the relatives come in, they realize that, let's give him the drugs. Maybe he forgot to swallow their medications. You will kill that patient. Let the doctors decide. What you do, just do your first aid, do what you can, then push the patient to the hospital. If patients have a stroke and you bring down their blood pressures immediately, they will lose their lives. So if you are there at home and a patient has had a stroke, and some people even have the blood pressure machines at home, they test the blood pressure, it is very high, it's 200 over 100. They go to the counter where they usually keep their medications. They tell them to swallow even 2. Don't do that. Please, let the patient come to the hospital. We will decide what to do. Even those drugs that they are using at home, we might stop them and give our own drugs that we know in the hospital to help. So don't rush to give this patient who has had a stroke. Already they have had a stroke. So even if you give these drugs, they will not help a lot. Instead, they will just kill the patient.
Yeah. Now, Daktari, as we wind up, apart from our lifestyle, does our dietary affect anything or put us in risk of getting these accidents? True.
I'll go back to the nyama choma guys. Yeah, definitely. If you take a lot of salt, if you take a lot of food with cholesterol, if you take a lot of food with fat, the saturated fats, like nyama choma, we have There are people who take fish, but fish is not bad. Although the way of cooking fish, people usually put it in the oils,
Deep frying.
deep frying.
Yes.
So people who love chips, people who love soda, the refined foods, definitely, if you see any food that has a lot of fat on it, it is a risk for cardiac arrest and stroke. So diet is very important. And you know, there's a lot of junk food. Nowadays you have KFS and other things in town, and we don't mean that they need to close business. No, it is people to understand. You cannot eat junk food Monday to Friday. You will definitely deteriorate your body and it will cause some
Monday to Friday, January to December.
Yeah, that is not possible. So you have to take care of your diet. Alcohol, take in moderation, stop smoking. It will help you a lot. So that plays a role in prevention of this. So there are people who blame stress and yet it is diet. So the number one risk factor for strokes, the number one risk factor for cardiovascular accidents, the heart attacks is actually diet. If I can set an example, if nearly 50 years ago in Africa, the cases of stroke were very low. The cases of cardiovascular accidents were very low. In fact, you could hear of one in a whole province. But nowadays, in a whole village, you will hear that there are people. Even last year, we buried so many people because of strokes and heart attacks. Why? People have shifted to the other modern ways of feeding, like the European ways of feeding, which is not good, because these cases of cardiovascular accidents have been more in the US and other countries from the European nations more than Africa. But currently, World Health Organization is looking at Africa in the next 10 years to be the leading continent in terms of these cardiovascular diseases, because the other countries have changed, but Africa is now moving to where the other countries were. So we need to do something as a country. We need to do something as a continent. Let's go back to where we were 50 years ago. Let's eat those foods that were coming from our own farms. And it will help prevent the cardiac arrest and even the strokes.
Any other ways, Daktari, to prevent these accidents?
Basically, you have to look at your lifestyle. I've told people who are working in offices, don't just sit on that chair for that long. If there is a health break, please, it is a health break. It's not a tea break. It's a health break. So go and walk. Take your tea from that kibanda far away from your office. Take your lunch from that kibanda far away from your office. Why do you want to get food? Okay, it's good to promote the vendor who is bringing you food in that office. But again, tell her or him that today I'll go and get my lunch from where you cook it from. Number two, stress levels. We need to control our stress levels. The country is currently in an economic state that is not good. But again, that does not mean that you carry every load in your heart. Make sure that you offload other things to other people so that they can help you, because stress can lead to strokes. Then lastly, diseases. If you have hypertension, if you have diabetes, why don't you come to the hospital? Right now, we've trained even that nurse in the dispensary. They can take care of your blood pressure. You don't need to come all the way to our county referral where I work. Just go to your nearest dispensary. Go to your nearest private hospital. I know people usually fear queues, but those queues save life. So go to the nearest hospital, make sure that you check your blood pressure, make sure that you check your blood sugar, you check your weight, they look at your body mass index, BMIs. If they are very high, the nutritionists are there, they take care of your weight, and things will work well for you. And again, exercise. People are not exercising. People have bought motorbikes. People love boda. They want to, if you look at somebody's phone book, they have almost 10 boda contacts. So if they try this, is not available, they go to another one. They just want this guy to pick them from their house to the workplace, and from the workplace to their house. Even if they are going to church, Even if it's a distance that they can walk, they just want to use the border guys. There are people who have bought vehicles, they don't want to drop the keys down, then they walk. So it's important that you change your lifestyle, stop using vehicles mostly, stop using borders mostly, walk. That walking will prevent the stroke. So those are the things that we need to take care of.
All right.
Yeah. Why don't we go back to our old ways of living so that we can prevent these strokes? Let's avoid the bread and butter. Let's avoid the sodas. Let's avoid every kind of this junk food, the chips and whatever, the nyamachomas. And actually, you will prevent the strokes. Let's avoid even the modern life, where we want to live a life that you will show people that you are living a modern life. So let's go back to our ancient ways of living as Africans so that we can prevent these cardiovascular accidents.
All right.
Yeah.
Thank you so much, Daktari, for that insightful discussion and briefing about heart attack as well as stroke. It is the end of Health, Hygiene and Wellness. My name is Barasa Saenyi. We've been having Dr. Silas here from the County Referral Hospital. I hope you've learned a lot about stroke and heart attack. Until next week, God bless you. Goodbye, Daktari.
Thank you.